Well, everybody has a different idea. And when
Right.
you think back on Obamacare, Democrats said, let's do it. And they united, and whatever it is, right? A lot of things they thought would work. A lot of it was moving the government closer to controlling healthcare, which continues in the wrong direction. And the Republicans have a lot of great ideas, generally, and conservatives, but communicating it, agreeing on it has always been an issue. That's a
Right.
much longer discussion for another day. But on healthcare itself, uh, we wrote one of our first issue briefs was called Patient-Centered Healthcare, talking about how patients should regain control of the decisions they make about their healthcare. And of course, health insurance is really the only insurance that you don't really pick yourself,
Right.
right? You buy your car insurance, you buy your auto insurance, you buy your life insurance. You don't buy your health insurance, you get it through your employer. Now you also get it through the exchanges. But when I worked on Capitol Hill, we had the Federal Employees Health Benefits Plan. So when I first got on the Hill, I was single. I picked the lowest cost Blue Cross plan. Then I got married. Then I had a daughter. And then I kept changing the plan to match what I needed. But Obamacare, as you know, has these broad categories. I think I'm covered for pregnancy. I'm not sure. But that's unlikely at 72, almost 73. Same with my wife, obviously. But the kinds of things that they force people to pay for has helped create the situation we're in now, where it has become unaffordable. And the money,
Yeah.
as we know, goes to the insurance companies. So we've talked about letting people make their own decisions about how they purchase healthcare for their own needs,
Right.
where you have these associations, not necessarily employers, association health plans. And these things really make sense because it allows people to have more control over what they decide and what they need. You're not going to buy a car that you can't afford. You're not going to
Right.
buy life insurance if you can't afford it. So why are we paying for healthcare insurance that we can't afford?